Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Judith Sears-Poisson, and I'll be your host today. Our webinar today is on expanded SNAP benefits during the COVID-19 pandemic, lessons learned. As many of you know, as of March 1st, 2023, all states have ended the expanded SNAP benefits available during the first few years of the pandemic. Our three presenters will examine the role of food assistance in the U.S. social safety net, discuss how SNAP was adjusted to respond to the public health and economic crises brought on by the COVID-19 pandemic, assess those interventions, and share how policymakers and practitioners can use lessons learned to improve on the program's efficacy and impact moving forward. First off, we'll hear from Dr. Cindy Leung, who is an assistant professor of public health nutrition in the T.H. Chang School of Public Health at Harvard University. She'll give us an overview of food insecurity in the U.S. and its effects on physical and mental health. She'll also share the role of SNAP, particularly during the COVID-19 pandemic. Next, we'll hear from Chloe Green, Senior Policy Associate for the American Public Human Services Association. She'll share information and insights from her direct work with state-level SNAP directors. And she'll discuss the emergency SNAP allotments that were available during the public health emergency and how the end of those benefits is playing out and what's next. And we hope that we will wrap up the presentations with Dr. Marianne Bitler, who had some car trouble and is waiting for a tow right now. So we're hoping that she'll join us a little later. Marianne Bitler is a professor of economics at the University of California, Davis, and is also an IRP affiliate. She'll share her very timely research into how well the social safety net as a whole, and SNAP in particular, responded to the COVID-19 health and economic crises, and what lessons can be learned as we move forward. Thank you all for being here. It's great to have such a nice crowd for this important topic. I also want to acknowledge the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their partial support of this webinar series through their funding of IRP as the National Research Center on Poverty and Economic Mobility. We have an hour today, and after we hear from each of our presenters, we'll spend the last 10 or 15 minutes or so at the end for a live Q&A. You can type questions through the Q&A box here in the webinar. We did get quite a few questions submitted as people registered, so we will be queuing some of those up as well. And I hope you'll feel free to participate through the chat. We love to know who we are speaking with. We do have closed captions enabled, so you can toggle those on and off at the bottom of your screen. And we'll be posting the slides and the recording of the webinar early next week, so you'll receive a link to both of those by email. So with that, thank you all again for being here, and we'll get started with Professor Leung.
Hi, everyone. Thank you, Judith, for that kind introduction, and to the Wisconsin IRP for putting this panel together and inviting me to speak. Let me share my screen to make sure you can see my slides. Okay. So I have the privilege of going first, and wanted to focus my talk on just giving a broad overview of food insecurity in the United States, why it is a concern, how it's linked with various health outcomes, and what happened to food insecurity when the pandemic hit, and how SNAP plays into all of these different compartments. So I'm going to go through a couple of slides. Some of this might seem very familiar to you, and I'm going to try to do my best to be topical and keep to SNAP and how some of these changes during COVID, what are the implications of that. So let me just start at the very beginning and define food security. Our definition of food security comes from the 1996 World Food Summit. And it was established then that food security exists when all people at all times have physical and economic access to safe and nutritious food that meets their dietary needs and food preferences for an active and healthy life. When any of these components are missing, then we have food insecurity. And so the USDA has adopted a similar definition, and they say food insecurity is the limited or uncertain availability of nutritionally adequate and safe foods, or the limited or uncertain ability to acquire acceptable foods in socially acceptable ways. And I appreciate all the different components of this definition because it shows that food insecurity exist if our food environment is not conducive to meeting our nutritional needs, if it's full of foods that are harmful to our body in various ways, or people have to resort to socially unacceptable ways to acquire food. Now, before the pandemic hit, we were measuring trends in food insecurity since the 1990s, and we can see how food insecurity responds to various economic shocks. So from 2000 to 2007, the national prevalence of food insecurity hovered between 10 and 12%. In 2008, after the Great Recession hit, we saw food insecurity increase. And for many years, that level was sustained at around 14 to 15%. And it wasn't until 2015 and the years following that we saw a gradual return to pre-recession levels. Now I'll come back to 2020 and 2021 in a few slides later. In the same USDA reports that established the national prevalence of food insecurity for that year, they also established who is more at risk of food insecurity. And so from these reports, we know that these are characteristics of households with prevalences of food insecurity that are higher than the national average. And year after year, the characteristics stay the same. So we know that households with children, particularly young children under the age of 6, are more likely to experience food insecurity. Households with children that are headed by a single parent are more likely to experience food insecurity. Black and Hispanic households have higher levels of food insecurity than white households, and households who are close to the poverty guidelines are also more likely to experience food insecurity. So we know that food insecurity disproportionately impacts groups that are already structurally marginalized in other ways, and food insecurity could exacerbate some of these existing disparities in health. Now, I am a nutrition epidemiologist by training, and when I started this work, I was interested in all of the ways that our diet is impacted if someone is experiencing food insecurity. So we've conducted a number of studies on food insecurity and diet quality. This was actually a study that we conducted during COVID. We administered a survey to lower income households, and we measured their food security using the USDA module. We also asked diet quality using a screener that's shorter than some of our more traditional dietary assessment methods that are very comprehensive and are very have a higher participant burden. So from this measure, we can calculate someone's overall diet quality. A higher number means a more healthy diet aligned with national dietary guidelines. And what we see in this graph is that there is a clear dose response, so that the more food insecure a person is, or says that they report that they are, the lower their diet quality. And we see that even when comparing the marginal food secure group. So USDA doesn't consider marginal food security as part of their collective definition of food insecurity. But we know that people who just worry that their food is going to run out, or who can't afford a balanced meal, even without any other behavioral indicators, we know that their diet quality is impacted. I've also been asked multiple times, are people who are food insecure, is it just that they're not eating enough fruits and vegetables, or are they eating too much of unhealthy, ultra-processed foods? And so we looked at the individual components of diet in this study. And what we found was that food insecurity was impacting diet across every single component in the adverse way. So these are all of the questions that go into this measure of diet quality. And we see that every food group, every aspect of diet, of healthy eating, is impacted for people who are food insecure. Not surprisingly, food insecurity has been associated with higher prevalences of cardiometabolic disease. And this is just a snapshot of some of the studies that have used nationally representative samples and have found that people who are food insecure are more likely to suffer from diabetes, metabolic syndrome, systemic inflammation, hypertension, and even non-alcoholic fatty liver disease. For children, there's been a robust literature linking food insecurity in households with children to children's outcomes. And so this is not an exhaustive list, but just some of the outcomes that have been negatively associated with children's food insecurity. So there's more outcomes that I wasn't able to put on this slide. And there certainly are dietary consequences of food insecurity. There's certain micronutrient deficiencies that have been observed. But when you look across these three columns, you will see that children who experience food insecurity have poor physical health outcomes, mental health outcomes, behavioral outcomes, psychological outcomes, developmental outcomes, and that food insecurity, especially for children, is not really just a nutritional issue, that the consequences that we've observed span every aspect of health, and it's not just poor diet. So one of my mentors, Barbara Lariah, she wrote a review paper in 2014 and talked about why food insecurity might have such a strong health impact, and what are the potential moderators and mechanisms for why this might be occurring. And I wanted to focus on this bullet, chronic stress. Chronic stress, I believe, is a very prominent mechanism for why we see all of those health outcomes I showed you on the previous slide, and for all of the adult cardiometabolic outcomes, and even the measures of diet that I showed you during using the COVID study. So why does stress matter? Well, food insecurity is an inherently stressful experience. In fact, one of the first papers that established our measure of food insecurity by Kathy Radimer and her group at Cornell showed that there was a strong psychological component as part of the conceptualization of food insecurity. Second, food is different from other basic needs. And so in my qualitative research, I've talked with a number of parents and children who experience food insecurity. The parents will tell you that their rent or their mortgage, their car payments, their phone payments, their medical bills, these are monthly expenses or maybe even one-off expenses. But food expenditures happen, could be bi-weekly, weekly, sometimes even daily. And I've had parents say that food is the first thing they think about when they wake up in the morning. How am I going to feed my children? Food is the last thing they think about at night. What am I going to pack for my child's lunch tomorrow? And so if we think about food insecurity through the lens of chronic stress, well, we know that stress impacts multiple body systems. Stress increases the risk of metabolic disorders. It weakens our immune function. It leads to anxiety and depression and other mental health conditions. And this figure is showing how chronic stress over time can increase physiological adaptations or allostatic load. So allostatic load is the overall wear and tear on the body that results from cumulative life stress. If we think about food insecurity as a chronic or even as a toxic stressor, it starts to be plausible why we see food insecurity is associated with so many nutritional and also non-nutritional outcomes. So what happened when the pandemic hit? March 2020, we started seeing shutdowns and people were staying home. We saw infections start to rise, and there were studies that were emerging around what was happening with food insecurity in those early months. So these were two studies that were published. The study on the left, over 10,000 adults responded, and they found that 38% of adults had experienced food insecurity in those early months. The study on the right was conducted in Vermont. They had over 3,000 respondents. They found a food insecurity prevalence of almost 25%. Now, we also did a study, food insecurity in the early months of COVID. We actually launched a survey in late March 2020, and we focused our study to lower income households, so households that were at 250% of the federal poverty level or below. And we found that 44% of adults were experiencing food insecurity. Those numbers were higher for adults who identified as Black or Hispanic, for adults who had children in the home, and for adults with the lowest incomes. We also found in that study that people who were experiencing food insecurity, particularly very low food security, which is shown by the yellow bars in this figure, that they had a harder time stocking up on food. So in the early months of COVID, we were advised to all stock up on 2 weeks of food in case of emergencies with our food supply. And people who were food insecure were reporting that they were not able to make that requirement because they couldn't afford to purchase that much food at a time. In addition, people who said they had low or very low food security, they said that they had reported issues with purchasing essential household items, paying their other bills, paying their rent or mortgage, which really shows that food insecurity was combining with other basic needs insecurities to collectively impact health. We asked about anxiety and depression, as well as perceived stress. And just like the slide I showed you with diet, we see a very clear dose response in all of these mental health outcomes. So the more severe someone's experience of food insecurity, the greater the odds or the likelihood that they were experiencing poor mental health. We had an open-ended question where people could tell us about their experiences in the early months of COVID. And people talked about feeling scared, feeling anxious, feeling stressed or depressed. We heard people talk about they felt exacerbated by their pre-existing mental health conditions, or that they were worrying about their ability to afford or access essential supplies. So this was an adult with low food security. He said, "I have lived week by week, just barely to avoid asking for help. Now I am falling through the cracks, invisible to a system suddenly flooded by the needs of people it already recognizes as needing help. I am in danger of losing my home and everything in it. I am very scared." This was a respondent with marginal food security. They said, "I have anxiety disorder, so this is worse on me. Every sniffle or runny nose, I now think this is a death sentence. I'm a nervous wreck anytime I have to go anywhere." And then an adult with very low food security, they said, "I'm low income, so even missing one day of work could make me sick or could make me and my family go hungry. We are suffering because other people got sick, even though we are healthy." We repeated our survey to a different sample of adults from lower income households in June of 2020. We wanted to see if some of those prevalences had decreased. And even though these are two different samples that were recruited using similar methods, we found that for most groups in our survey, the levels of food insecurity were sustained a few months into the pandemic. So anecdotally, and from some of these studies, we were seeing that food insecurity levels were skyrocketing during 2020. And so in 2021, when the national report about food security came out, it was established that in 2020, the national prevalence of food insecurity was 10.5%. And then 2021 was 10.2%. And these were not significantly different from 2019. And so for those of us who were studying this, and we were seeing the lines at our local food pantries, and we were talking to people who were experiencing this day to day, we were shocked to see that the levels nationally weren't higher. And when we think about why this may be, we can start to unpack all of the different policies that were passed during COVID that might have influenced food insecurity. So this is a graph from Politico, and I think this figure shows really clearly how food insufficiency, which is a similar measure to food insecurity, declines in response to temporary financial and food assistance boosts that were provided as part of the COVID-related economic recovery. And so I found this graph really helpful because it shows that there are short-term benefits to food insufficiency that are immediate when you provide economic relief or when you increase SNAP benefits. And it also shows that food insecurity is both preventable and reversible if we have strong enough policies that can make sure people have adequate access to nutritious foods. So this is my last slide, and I just wanted to end by talking about some of the policies that were enacted during the during the first 2 months of the pandemic that might have contributed to why we didn't see these stark increases in national food insecurity. So we really mobilized SNAP during the first year of the pandemic. By 2021, there were almost 42 million people that were participating in SNAP, and the overall cost of the program had expanded to $113 billion. And so we see that in March 2020, right away, there was the Families First Coronavirus Response Act. This raised SNAP benefit allotments to the maximum amount for that household size. It relaxed work requirements for able-bodied adults without dependents to receive benefits, and it provided states with greater flexibility to recertify existing participants, so people didn't have to go into the office anymore and see their caseworker in order to make sure that there was no gap in their benefits. And then the next year, we see the American Rescue Plan Act of 2021. This led to another increase in SNAP benefits, also allowed states greater administrative support to process more applications. We see the online purchasing pilot, so people could purchase food with their EBT card online. They didn't have to go to a physical store to purchase food and swipe their card at the point of sale. And we also saw through the Biden administration, through a White House executive order, a reevaluation of the Thrifty Food Plan, which up until this point hadn't been done since 2006. And then this led to a 21% permanent increase in SNAP benefits. So all of these policies contributed to lower levels of food insecurity than we had initially thought. And I think we can learn a lot of lessons for how SNAP was expanded during the pandemic, and hopefully take those lessons forward now that the public health emergency has ended and informed the next Farm Bill, to make sure that what we've learned during COVID can be sustained through the next potential pandemic, or just to continue providing food and economic relief to families who need it the most. So thank you very much, and I look forward to the Q&A.
Great, thank you so much, Cindy. That was really, really helpful, and really sets the stage well for us hearing from Chloe Green next, Senior Policy Associate for the American Public Human Services Association. I do want to let people know that Marianne Bitler has joined us, so we will be hearing from her after Chloe. And a reminder that if you have questions coming up as you're watching the different presentations, please put those in the Q&A. I'll be watching those and sharing those with the panelists when we get to the Q&A portion. So please feel free to use that. And with that, we'll turn it over to Chloe.
Thanks so much, Judith, and thanks, Cindy, for giving that really important overview of SNAP and really grounding us in what food insecurity looks like in this country. So my job today is to talk a little bit more specifically about those SNAP policies that have been happening since the start of the public health emergency, what's been changing, and what's to come in the next few months. So as Judith said, I work for the American Public Human Services Association, or APHSA, and we are the bipartisan membership association for state and local human services agencies. So we represent folks from the political leadership to the program level staff in these agencies. And specifically, my job is to work with state SNAP administrators and their teams, so the folks who are responsible for taking the policies that Congress passes and the regulations that the USDA Food and Nutrition Services put out, and making and implementing them into practice. So I wanted to start off with a bit of a refresher and some overview of how policies have changed. And again, thanks to Cindy for starting this off. But so in the beginning of 2020, a public health emergency was officially declared for the COVID-19 pandemic. And this was important because then when some really big policy pieces got passed, so the Families First Coronavirus Response Act in March of that year, a lot of these authorities to give more flexibility to SNAP were tied to this national public health emergency. And I'll talk in a moment a little bit more about what I mean specifically about SNAP flexibilities. But so we did see states across the country use these flexibilities, especially when the pandemic first started. And then in 2021, we started to see states diverge a little bit more in which waivers they were using and how. And then we also saw another big policy package passed in the American Rescue Plan, which, in addition to passing that temporary 15% increase in SNAP that Cindy mentioned, also passed a little over $1 billion in additional SNAP administrative funds to support states, both in filling some gaps that were created by responding to the pandemic and doing what they needed to do to support the communities that they work in, and also to help states start thinking about the future of SNAP and making more modern experiences that are better for the customer. Last year, we saw states continuing to diverge in how they were using flexibilities, but also a really strong recognition that at one point this public health emergency is going to end. And therefore, these flexibilities that states and people who receive SNAP have gotten used to are going to start going away. And then in December of last year, the Consolidated Appropriations Act of 2023, or what I'll call the Omnibus, was passed. And that created an early end to these additional SNAP benefits or emergency allotments. And I think that's what's on a lot of folks' minds today. So now we're looking in 2023, all states have had to end these emergency allotments. And they're also going to see, when the national public health emergency officially ends in May of this year, several other flexibilities start to go away. So what do I mean by flexibilities? So a little bit more about emergency allotments, so additional SNAP benefits. There's probably different things that you've heard about these. But what I mean specifically is that in March 2020, in that Families First Coronavirus Response Act, Congress said that all households could receive up to the maximum benefit level for their household size. So there's a lot of different things that go into calculating a monthly SNAP benefit, including age and household members and work status and things like that. But it was now just people could receive up to that maximum benefit. However, there were some inequities at the beginning because people who had already been receiving the maximum benefit didn't receive an extra bump at first. However, this was changed in the next year when FNS relooked at that and said that all households could get at least $95 more per month. So when you're thinking about this loss of benefits, it is significant for people across the country. I also just want to say that while I know people are really talking about that March end date to these additional benefits, about a third of states had already ended their emergency allotments before then for different reasons, including if their state had ended a public health emergency already. But about 2/3 of states and about 80% of people who receive SNAP did just see their emergency allotments end. Also, something else tied to this national public health emergency are work requirements, or more specifically, time limits for a population known as able-bodied adults without dependents, or ABODs. And SNAP says that if you are in this population, that unless you're working 80 hours per month, you can only have 3 months of benefits in a 3-year period. But during the pandemic, this time limit was paused so that people could continue to receive benefits if there weren't work opportunities. And but this time limit will be restarting later this year. Also, which many of you probably know, there have been additional flexibilities for college students to be eligible for SNAP. So college student eligibility can be kind of tricky sometimes, but during the pandemic, Congress has said that if students qualify for federal work study, or if they have an expected family contribution of $0, then they could be eligible for SNAP. But again, that's tied to this declaration of a national public health emergency. Some other flexibilities that I won't go as in depth about today, but are also really important to state and local agencies, have been flexibilities with telephonic signatures. So this made it easier to conduct interviews and go through the eligibility and certification process over the phone in a virtual environment. There's also been flexibilities around interviews, such as even waiving an interview in order to find out that someone's eligible and to get them their benefits. And then also flexibilities around extending certification periods and adjusting periodic reporting, so reporting in the middle of certification periods. And if you'd like to know more about these type of administrative waivers, I've linked later in these slides that will be sent out later, some work that we did with the Johns Hopkins School of Public Health to do a really in-depth analysis at the beginning of the pandemic for how states took waivers, what waivers they took, and why. So back to where we're at right now and what's to come in the near future. So like we mentioned, all states have now stopped issuing these emergency allotments. Also, just this week, all states had to start their Medicaid unwinding process. So what I mean by this is that similarly to how Congress authorized these flexibilities in SNAP, Congress said that during the public health emergency, no one could be kicked off of Medicaid. So, but now state agencies are having to go and start recertification processes to see if people are still eligible for the program. And this is important to think about in tandem with SNAP because, first of all, a lot of the same agencies that do Medicaid also do SNAP. So these things are happening in the same places and by the same workers. But more importantly, a lot of people who receive Medicaid also receive SNAP. So we see these really big changes happening to the same people at around the same time. And then a little more about those college student flexibilities that I mentioned. So those are going to start ending in June of this year for people that are newly applying to SNAP. And then it will come at the end of when it's time for people's recertification that are already receiving SNAP. And then that ABOD time limit is going to start counting again from the beginning, starting in July of this year. So that's for that population to work 80 hours a month to receive SNAP. And finally, I did just want to mention that FNS has put out that some of those other flexibilities I mentioned can be continued to be used by state agencies for up to a year or more after the public health emergency to help with some of these transition pieces. So notably like the telephonic signature piece, for example. So with all of this going on, I did just want to take a moment to talk about what states are doing and how they're supporting people that receive SNAP. So first, one way is that I believe in over half of states now, there's been at least legislation introduced in their state legislatures to think about using state funding to increase SNAP benefits, either permanently or as a step down. So for example, in Massachusetts, they just passed a bill to fund for the next few months a step down in SNAP benefits so that rather than a huge benefit cliff of losing an emergency allotments, it'll happen more transitionally. And then in other states like New Jersey, they've passed an increase to their minimum SNAP benefit level. And in California, they're hoping to do that by 2025, or they will do that by 2025. And in Maryland, they've raised the minimum specifically for their senior population. And I should mention that these people that are expected to drop the most by losing their emergency allotments and going back to their SNAP benefit level is largely seniors who tend to get those minimum SNAP benefit levels. So it's an important population to be paying attention to. I also want to say that across the country, states have been investing in more modern technology and looking at how to improve customer experience. So notably how to make virtual interactions with SNAP easier and how people can be using their phone or computer to update their information and get their notices, things like that as we move into a more virtual world. And if you'd like to see more about how states are doing this, or specifically how they're using those funds that I mentioned from the American Rescue Plan, I've also linked to some work that we've been doing with Share Our Strengths Center for Best Practices and the Urban Institute to understand how states are using these funds. And finally, I want to say that, as I mentioned, this is not new to states that these flexibilities were ending and that emergency allotments were ending. States have been preparing for this for years now and are just increasing their outreach and continuing to align across their programs like SNAP and Medicaid And I also know that many of you on the line have been doing a lot of this work to support outreach to the communities you work in as well. So it really is a full effort for everyone to be making sure people know that these changes are happening. And finally, I would be remiss if I did not mention that this is a Farm Bill year. So the Farm Bill is this huge piece of legislation that's reauthorized every 5 years. And about 80% or more of the funding in the Farm Bill is for nutrition programs, and most of that is for the SNAP program. So this is really our opportunity to be looking at what should be continued to be tested in SNAP, what should we be newly looking at, and what do we need to change in SNAP to make it really a more customer-centered, effective, and modern program. So if you'd like to check out how APHSA is looking to see the Farm Bill and changes in SNAP, I've linked to our Farm Bill recommendations and then also these other reports that I've shared as well. But with that, I want to say again, thank you all to all the work you're doing, and I look forward to hearing your questions in our Q&A section.
Thank you so much for that, Chloe. That was some really great information. And just to remind everyone, we will be sending out a link to the archived video and to the slides. So all of that great information that has been shared and will be shared, you will have access to shortly. So we'll now turn to Dr. Marianne Bitler, who's professor of economics at the University of California, Davis, and an IRP affiliate, to finish off our conversation. And again, please do post questions that you have in the Q&A box. We'll turn it over to you, Marianne.
Hi, everyone. I had a very exciting morning, so if I seem a little rattled, bear with me. I'm going to talk a little bit about where SNAP sits in our safety net first. So as I think many people on this call know, we have a patchwork safety net with a wide range of programs that are not well integrated. They serve two purposes. First of all, they provide a floor for eligible people's consumption, either directly, like with SNAP, where you can use it to buy food, or indirectly by giving people cash. And they provide stabilizers during economic downturns. And because we have this federalized system where states and local governments can play an important role in how these programs run, programs can vary considerably across locations. It's also true that changes starting in the early 90s have meant that our safety net is more of an in-work safety net that combines working with giving you benefits. And the lack of integration of the programs and data and the need for eligible people to apply differs from many other countries. We've stressed the safety net a lot recently, first in the Great Recession during the late aughts, and then more recently during COVID. So just to give you a sense of where we started before this, we have, because of these changes with welfare reform and the creation, the big expansion of the earned income tax credit in the 90s, we have more in-work welfare and less automatic stabilization than we used to. So the EITC does a lot of great things. It increases single moms' labor force participation. It has positive effects for kids and mothers, but it's not set up to respond to economic downturns. And the reason is, for the vast bulk of people now for everybody, you earn the money in the previous calendar year that qualifies you for the EITC, and that it's paid out to you the following year when you file your taxes. So first of all, some people might lose their work and not be eligible for it anymore. And secondly, the money doesn't come when the shock happens. TANF, which replaced the previous Aid to Families with Dependent Children program, is a block grant, and it's mostly been repurposed by states for in-kind spending, and it's also fixed in nominal terms, so it can't expand very well during bad times. So this means that the food stamp program, or SNAP as it's now called, remains the main unconditional program left for most people. In the background, unemployment insurance plays a very important role, but this is also run by the states, and states have made quite different policy choices about this. So one might ask, are these programs adequate? Maybe not at the very bottom, and they're not all very responsive to shocks. And so now I'm going to tell you what we expected before this and what happens after. So SNAP is relatively uniform compared to other programs, but as was touched on by Chloe just now, there is a lot of variation across places for states and local offices. And there was both state variation in policy before COVID and in which USDA options states implemented. So why would you think it's good to have a federalized system? Well, there's pros and cons to this. So the argument for having a federalized system is that local areas can make choices that better reflect local needs. It's closer to citizens. But a con is that, sometimes state and local actors don't have the same goal as the federal government. So during the Great Recession, not every state was excited to suspend the ABOD time limits, even when USDA was encouraging it. The other downside of a federalized system is that data acquisition, management, bureaucracy, and the ease and public cost of determining eligibility vary widely across locations due to capacity constraints and due to other factors. So what did we think was going to happen with SNAP before COVID based on previous developments? Well, together with Hilary Hoynes and John Iselin, we used administrative data on participation per capita and spending on SNAP per capita at the state level from 2000 to as near to COVID as we could get to try to see how well various different programs, not just SNAP, but many other programs, were responding to labor market shocks. And we modeled labor market shocks with state unemployment rates. And no one would be surprised to find out the unemployment insurance program was the most responsive. Not everybody who is unemployed gets UI, but you have to be unemployed to get UI or on temporary layoff. But SNAP was quite responsive as well. TANF, unlike its predecessor, AFDC, was not responsive anymore at all. And again, perhaps not so surprisingly, social insurance programs are set up. So that includes, old age Social Security, disability insurance, and unemployment insurance. They're set up to respond to shocks. The means tested programs do not quite spend as much more when times are bad. But SNAP's responsiveness makes sense if you think about how the program is designed. It's an entitlement program. So if more people become eligible and apply, they're supposed to get onto it. And it's a program you can get onto relatively quickly compared to some other programs. So what did we find for SNAP? This is from some work with Hilary Hoynes and Diane Schanzenbach, who may be familiar to many people who've done a lot of work on the SNAP program. In our work, we combined the CPS, both the March ASEC and some of the food security data, and then the Census Pulse data. And we used a lot of administrative sources for spending. And this is, a useful complement to survey data that looks at how much people, how many benefits people get, because, this is supposed to measure what the government thinks it spent. So we have both Treasury statements that say when the federal government sent money to the states to send out to people. And we have USDA data on SNAP caseloads and then total payments that went out. So as we saw, and as you would expect based on the policy, SNAP spent more. First, it paid everyone the maximum allotment, and later on, there was this change to make sure people who were already at the max allotment getting the max benefit also got more SNAP. As was already pointed out, SNAP was easier to stay on. And there was also this additional pandemic EBT program, which was supposed to replace missing school meals, and also, went through, at least some parts of it went through this SNAP agencies in the states. And then because it's an entitlement, we think participation should go up. So I'm just going to remind you how big this shock was. These are unemployment rates by race ethnicity, and you can see this enormous change from March 2020 to these other, this much higher level, and then things staying relatively high for quite some time. We know people suffered. Cindy's already shown us some figures like this, but on the left-hand side, it's showing annual food insecurity in 2019 versus 2020 from the same source that she was showing the overall means for. On the right side, for my screen anyway, you see households with children, and you can see this thing, not much of a change in food insecurity overall, but a decline for households with children where the children are white, and an increase in food insecurity for Black families with Black children and families with Hispanic children. And, this fits with where some of the big economic hits happened. This figure shows us new spending net of what was spent in the previous calendar month, in the previous calendar year. And each of the different colored bars is a different program. So the EIP is the stimulus, which you can see was very big in the specific months where the stimulus payments went out. UI is the blue bars. UI payments are considerably larger than SNAP payments for the average person. So you can see a lot of money went out through UI. SNAP, lots of SNAP money went out, but this is the additional amount compared to the previous year. And then here at the end of the time period, you can see the refundable child tax credit that was temporarily expanded. So, despite these efforts to really increase spending, we tried to simulate using quality control data from USDA. What were the characteristics of people who would be getting the increased allotment with everybody getting the max allotment compared to people who weren't and suspected it might not be so well targeted. And in this chart, we're showing you on the x-axis, the change in the number of people employed at the county level. And the y-axis is the change in the SNAP benefit between January 2020, January 2021 minus January 2020. And you can see this actually has a counterintuitive finding. You would have expected more SNAP benefits to go to places that had larger changes in employment, but that's not what we find. In fact, the increases in the spending went to places with smaller employment losses. By contrast, if I were showing you the same chart for participation, it would have the expected negative sign or negative slope in that you would find more people on SNAP in places where there were bigger shocks. And so I'm just about done, but I think that our work reflects that our current safety net is not well designed for providing a lot of buffering for folks during economic downturns. We've shifted over the past 25 years to a work-based safety net, which boosts low earnings but doesn't have a lot of out-of-work payments. And these two programs together don't provide much insurance against job loss. SNAP spending is counter-cyclical, but the worst off were not targeted with these early COVID SNAP expansions. And I suspect we would see less of that if we were to update this to go through January of 22. And I think this is an opportunity to leverage what we learned during COVID and more broadly. We know people stay on programs more if recertification is easier. We know reduced administrative burden for people to apply for and get onto programs helps if the goal is for more participation. Trying to add new programs on the fly is hard. I don't have time to talk in great length about, the pandemic EBT program or UI, and that's actually not the point of this particular webinar. But, there were delays in getting a lot of that money out quickly because it required new programs to be set up. So maybe there are ways to build this capacity into current programs. So I'm going to close with some possible SNAP policy changes. From a political economy perspective, in-kind benefits can be attractive to both sides of the aisle because we know things like SNAP shift spending towards food consumed at home and increase food spending. Economists, of course, like the efficiency of letting people also choose what they want because they think it's going to waste less money. We could do a better job of targeting the expansion. So perhaps next time, instead of just going to the max allotment, we could do something more like the later change, which made sure that everybody got a boost to their SNAP benefits. I think automatic stabilizers would be a useful thing instead of having Congress have to decide to increase max benefits and waive ABOD rules. Perhaps we could move to triggers based on the unemployment rate, like the ones that, sort of decide whether states can apply to have ABOD rules waived. And SNAP benefits, for the most part, at least the federal piece is fully funded by the feds, unlike some other programs. So states are only paying for their share of the administrative costs. And SNAP is always relatively big, so it's easier to ramp up than some programs. The UI program, by contrast, is really big when times are bad, but then when times are good, there isn't as much need for it. And so it's hard to keep it in a state that's ready to go when things don't go well. It would be nice to have more flexibilities and to have, the online shopping be expanded everywhere for everyone. And then finally, in terms of new programs, pandemic EBT, is effective and perhaps a model for something to keep around for the next time things don't go well. And then I would also just point out that much of what you heard, both from Chloe and from me and probably from Cindy, but I wasn't here, is that states still have a big role in programs like SNAP. And we see that some states want more money to go out and others maybe don't. And, it's important to keep that in mind when you're trying to understand how programs behave. And I think that's what I had to say. And now I got to find my controls, or you can just reclaim control yourself.
Well, thank you so much for that, Marianne. What a great compliment of the 3 different presentations and experts who we just heard from. And we do have about 7 or 8 minutes for some questions, and we do have some queued up here. So I'm going to jump right into those if that's okay. Chloe, I think this is one that probably almost everyone on the call, maybe everyone is interested in. Can you share lessons learned and policy recommendations that can appeal to legislators on both sides of the aisle?
Yep. So as APHSA is a bipartisan organization, we've really been tailoring our recommendations to what will make SNAP work better administratively. And I think there's a lot of things that are just smart policy decisions to be looking at. So some are pretty wonky. So looking at testing different things that would change how states spend their time and money, to be able to spend more time actually working with people and customers directly. I think that's something that everyone can agree with, is really wanting to center the customer in the SNAP program. I think some examples of that specifically are looking at where state agencies spend their time and understanding how to do that. So things like making virtual programs easier, or the mobile EBT pilot that just went out and being able to expand that further across the country. And then there's other things that we're looking at. So things like, we have a question that was looking at how to support more people who are elderly, since they're really receiving the brunt of the loss of the emergency SNAP benefits. And there are demonstration projects right now, such as ESAP, or the Elderly Simplified application project, or standard medical deduction, that make it easier for populations who are elderly or disabled to get on and stay on SNAP.
Thank you so much for that. Marianne, we had a question asking if you could kind of give us an idea of what the crisis would have looked like if those SNAP benefits had not been expanded to respond to the pandemic, even if it could have maybe been faster or easier or more appropriately targeted. If that hadn't happened, what do you think we would have seen?
I think there would have been more hardship and worse food security for families. I don't think there's any question about that. It's hard to, so I think for the most skeptical person who would want to run a randomized controlled trial to see the effects of everything, they might be a little dubious about this. But I think overwhelmingly the evidence that we saw, including both what Cindy presented and other stuff that I've seen, as well as my own work, just suggests that it played a large role in helping families. Everybody needs to eat, and having benefits is important. And I think it also shows, SNAP participation went up, WIC participation went down, and WIC is, not in as many places and has more things that are in the way that mattered, that things were remote than, say, SNAP did. So I just think there's no question things would have been worse.
Well, and one of the elements that we haven't actually touched on directly is that prices went up incredibly during the pandemic, not just because of the pandemic, but you as an economist would be able to talk for hours on that, I'm sure, Marianne. But given that, so we're seeing these rollbacks, and yet huge sticker shock going to the grocery store. What do you expect to see in these coming months?
Well, Chloe could probably say more about that than me, but I think that there's, there's a heated discussion coming about the Farm Bill, because there's a set of folks who think that work requirements should be, if anything, expanded. And then there's a set of folks who are concerned about this loss of benefits. Now, in practice, the expansion of the Thrifty Food Plan means that there was less of a fall off than there would have been otherwise. But that was clearly, there was a National Academy panel report sort of suggesting modernization. I'm sure there are other things, but that's the thing I'm most familiar with, that sort of argued we weren't spending enough. So I think we just don't know. It depends on how the negotiating goes.
Chloe, did you want to add something?
Yeah, I just say so that Thrifty Food Plan update, and that was called for in actually the 2018 Farm Bill, is to reevaluate the real cost of a healthier diet. And so that increased benefits by like somewhere 20 to 27%, estimates say. And I also say that every year SNAP benefits are looked at for inflation and adjusted slightly as well. However, we know that it's still really hard to make ends meet in purchasing those.
And I would just add that that usually happens in October, right, Chloe? So it happens once a year. So if there's a big price increase that happens in between, there isn't anything that can be done the way this program is currently structured.
Yep, it's with the federal fiscal year, so October 1.
Thank you for that. We have just a couple minutes left. I want to ask, and I'll direct this to everyone, but Cindy, if you'd like to start first. With the end of these expanded SNAP benefits, how is that going to affect people in other areas of their lives? Things like affording housing, medical, transportation, all those things that perhaps we're not being paid directly for with the SNAP benefits, but we're taking a little bit of the burden off of other parts of a budget. Cindy?
Yeah, I think that's a really important consideration. And even though SNAP benefits are meant to be supplemental, what we hear from people who use SNAP benefits is that it replaces the money that they would have been spending on food out of pocket. And it shifts that money to be spent on other household necessities. And so what happens with decreased SNAP benefits, especially to the amounts that we're seeing with the end of the emergency allotments, is that people's food budgets are going to go down because there's not that extra income from their housing budget or their other that are set aside for other bills currently that they can shift around. If anything, the food part is the piece that is most flexible. So if there's an unforeseen expense, like you get a traffic ticket or you have to pay a medical bill, that usually comes out of someone's food budget. And so that's why SNAP is so important, is that it makes sure that that budget is protected for food. I also wanted to just piggyback off of the question that Chloe had responded to. I know we all think about SNAP as being so political, and different sides have their different requests. And my group, we've done several studies with SNAP participants themselves about what policies they would support. And across the board, the last time we did a survey was right before the Biden administration took office. We asked about supporting policies to increase SNAP benefits, to subsidize online grocery delivery fees, to expand access to college students. Almost every single policy we asked about had tripartisan support from SNAP participants. So SNAP participants themselves are aligned on making sure that this program doesn't go away and continues to serve their needs.
Great, thank you for that, Cindy. Chloe, did you want to add anything?
No.
Okay, Marianne?
And I would just point out that I think we also have lots of evidence that, parents buffer their children when these things happen. And so, just because children's food insecurity didn't go up, maybe, or didn't go up as much, it doesn't mean that someone else somewhere else isn't adjusting.
Thank you so much for that. Thank you all. Thank you, Dr. Cindy Leung, Chloe Green, and Dr. Marianne Bitler for sharing your time, expertise, research with us today. Really informative, as you can see in the chat, very much appreciated by me and by our attendees. As we mentioned before, we will be posting the slides and the recording of the webinar early next week, and anyone who registered will receive a link by email to those. So thank you all for joining us today, and I hope you have a great rest of your day. Take care.
Thank you.